In this video, we will review high-yield ophthalmology cases focused on infectious diseases, immune-related conditions, pupillary abnormalities, and neuro-ophthalmology. These cases are designed to help you recognize key clinical patterns, understand underlying mechanisms, and reinforce essential concepts for exam preparation and clinical practice. Case 1: A 40-year-old man comes to the emergency department with painless, progressive visual impairment. He has a history of HIV infection for 4 years and is currently compliant with his antiretroviral therapy. His most recent CD4 count is 30 cells per millimeter. Funduscopy reveals yellow-white, fluffy areas of retinal necrosis associated with retinal hemorrhage. The question is, what is the best initial therapy? The correct answer is ganciclovir. Patients with HIV or AIDS and CD4 counts below 50 cells per millimeter are at highest risk for cytomegalovirus retinitis. This condition typically presents with slowly progressive blurred vision, scotomas, floaters, or photopsia. Most cases occur due to hematogenous dissemination of cytomegalovirus. Serum testing may be negative in up to 50% of cases, so diagnosis is usually made by funduscopy showing characteristic yellow-white retinal lesions with hemorrhage. Treatment is necessary to prevent progression and blindness. Ganciclovir is a guanine nucleoside analog with strong activity against cytomegalovirus DNA polymerase and is the first-line therapy. Patients should also continue antiretroviral therapy to improve CD4 count. A major complication is retinal detachment due to replacement of damaged retina with thin atrophic scar tissue. Case 2: A young man presents to the emergency department after an accidental penetrating injury to the left eye. He has globe perforation with decreased visual acuity. The right eye is normal. Surgical repair is performed, and vision improves. 2 months later, he develops pain, photophobia, and decreased vision in the right eye, the contralateral eye. The question is, which immune process is disrupted? The correct answer is immune privilege. This patient has developed sympathetic ophthalmia, a granulomatous inflammation of the contralateral eye following trauma. This occurs due to a T-cell-mediated response against previously sequestered ocular antigens. The eye is an immune-privileged site, meaning inflammation is normally suppressed through mechanisms such as physical barriers, absence of lymphatic drainage, and low expression of MHC class I trauma can expose these antigens and trigger an autoimmune response. Because of the risk of bilateral blindness, severely damaged eyes with no visual potential may be surgically removed to protect the unaffected eye. Case 3: A pregnant woman at 16 weeks gestation comes for a routine prenatal visit. 2 months ago, she had a mononucleosis-like illness with fever, myalgia, and fatigue, and was diagnosed with cytomegalovirus infection. She recovered with symptomatic treatment and is now asymptomatic. The question is, what eye condition is the fetus at greatest risk for? The correct answer is chorioretinitis. Primary cytomegalovirus infection occurs in up to 5% of pregnancies. Vertical transmission happens in about 1/3 of cases, especially during the first trimester. Congenital cytomegalovirus infection can lead to multiple complications, including chorioretinitis, which is the most common ocular manifestation. Other findings include sensorineural hearing loss, seizures, jaundice, hepatomegaly, splenomegaly, and microcephaly.